So, a person comes for therapy. You know, he has depression, anxiety, anger problems. Many times you think, what, we're going to go to therapy, I'm going to sit down, talk, and I'm going to get better. Someone just talks to me and I'm suddenly going to get better. What is exactly therapy? How does therapy work, and how does it help a person? We need to understand that yes, talk therapy can work, but the best way to do it, when we do it in a structured way, is if this person came with anxiety or anger problems or depression, he didn't just get up one morning and he's depressed. We need to figure out what was the root of the problem and try to work with the root and not just with the depression. You know, we can't just make him laugh and now the depression is gone. We need to see what is the root. So a lot of times people and the founders of CBT claim that the root is negative thinking. This person had negative thinking, and because of his negative thinking, he developed the depression. You know, he had negative thinking, and because of negative thinking, he got anxiety problems. So yes, that is true. Because of negative thinking, we get anxiety, anger, and depression. But that's not the root. That's not, you know, treating it is like we have a sewage in the yard, and it's spewing all this sewage into our living room, and we just keep cleaning the living room from the sewage. We need to go first, clean up the sewage problem, and then clean the house. You know, it doesn't make sense to just go and take care of certain things without taking care of the root. To take care of the root, I will make some kind of video and show it constructed in a nicer way. But right now I just want to say it in a general way. We have to realize that the root is always a trauma. There's a trauma. The person was traumatized. Because of the trauma, he got negative thinking, or you know, people call it twisted thinking. I like to call it negative thinking. Once he had negative thinking, he developed depression, anxiety, and anger. So to treat the depression, the best way and the right way is to go first and see where was the trauma that originated this sequence of events that causes this person to become depressed. So we need to go and look for the trauma that caused this person to become stressed, braced, realist, cynical, and developed the negative thinking, and from the negative thinking, the depression. Once we take care of it, in that sequence, when we take care, I'm not saying that we have to go and hunt every trauma, but the big main trauma, we work with that, then just automatically we can take care of the other things, and we can definitely help the person come out of depression, not have any more anxiety attacks, and be able to manage anger problems. So the root is the trauma, and in a video I'd like to explain exactly how one causes the other.